where we practice things like injections and blood pressures. And then we also, in the lab, do something called simulation, which means that we're making an imitation of actually being in the hospital. And we're going to do a short demonstration of the simulation for you, because once the students learn how to do things like take blood pressures and listen to heart rates and put oxygen on, and once they study about when they should do those things and what they mean, then they're ready to put those two things together and do it on a practice patient. So what we did, this is the first semester for these students. So what we did, we created a patient, and her name is Claudia Clemson, and we just made up that name. Nobody here has that name, did they? And every once in a while we make up a name, and then there's somebody in the class with that name. She has been with us all semester. So whenever we're discussing a particular thing in lecture or doing something in lab, we try to do it to Claudia Clemson. So if we're talking about urine bags, we give her a urine bag. It's not real urine. It's fake. Or if we're talking about IVs, we'll give her an IV. If we're talking about a special kind of tubing to give her feeding in, we'll give her that tube. So the nice thing about it is that not only are you studying from a book, but you're actually doing the stuff that you're studying with your hands on the patient.
So it's hands-on.
So yeah, it's quite hands-on. So what we're going to do is that I have 4 students today who have volunteered to help show you what it's like when we do a simulation. And I'll let each of them introduce themselves. They're all from my Tuesday morning lab.
My name is Josephine.
Hello.
I'm Josephine.
Hi.
My name is Yolanda. Hello.
Hello.
My name is David.
Hello.
I'm Eugene.
Okay, now these students have all different backgrounds in terms of experience in healthcare. Some people come into nursing and they're already a nurse's aide or an EKG tech or a patient medical assistant, and some people come in with no previous experience with healthcare. So we have all types, and this is what, after the first semester, and we have representatives of all different backgrounds right here in terms of their experience. So we're going to start off, this is the way we start off the simulation, is that I am going to pretend to be the night shift nurse, and I'm going to give a report to my 2 nurses, which is Josephine and David are going to be the 2 nurses that are going to take care of this patient. You're going to hear me give them a report. Josephine is going to be, pretend to be the nurse, and Dave is going to pretend to be the nursing student, and they're going to work together. I'm going to give a report to the patient, they're going to leave a report, and they're going to come in, and they're going to take care of the patient for about 5 minutes, and you can see what kinds of things they might do. Now this is a very special patient. She is a mannequin that actually has a heartbeat, and she has breath. You can hear her breathe, and she has a pulse, and she has blood pressure. So when they go to take care of this patient, they can actually, I will set the blood pressure and the pulse on my machine here. And then that gives them a chance to test their ability to read the correct vital signs. So you're going to see how they do that. She also has a microphone in her head. And I'm going to speak through that microphone to be the voice of the patient so they can practice talking to the patient. Wow. Very good. She doesn't get up and dance.
Okay. I would hope she wouldn't.
So what happens is that when we get our new lab, what will happen is this will all be in one contained room, and you won't even see me. So I'll be off in a little control room and remotely being the voice of the patient. The students will be completely alone taking care of her. Right now you're going to see and you're going to hear my voice. We don't have it set up yet. And just make sure that all the wires are connected and turned on. That's always a good thing to start off. And you will see that what we expect from the nurses when we start the simulation is that you have to be an actor. And you don't stop, and there's not going to be any discussion with me. They just have to do what they do, whether it's right, whether it's wrong. They're going to do it. We'll see what happens. And then the next thing is we'll stop and then discuss it. So are we ready to begin? Let me, so the first part, I'm not going to be the patient. The first part, I'm going to be the night shift nurse. I'm going to give a report. Is the chart around here? I don't have to have it though. Oh, it's right on the other side. Oh, it's right there. So, are we ready to start simulation?
Sure.
Okay, so here we go. Hi, I want to say about the patient in room 217. Her name is Claudia Clemson. She's 73 years old, and she was admitted here because she had a stroke 2 weeks ago, and she has a weakness on her left side, and she has trouble swallowing. So she has been progressing in physical therapy and has been stable, except she does have problems with swallowing. She has a feeding tube, and she gets her feeding during the nighttime, but she did start actually taking some food by mouth last night, pureed foods, had some trouble with coughing when she did that, but seems to be okay. Her vital signs, blood pressure, pulse, temperature are all normal, and she had a quiet night and rested well. She is a full code, and she's allergic to codeine. Do you have any questions?
No, I think we have everything we needed.
All right, thank you. Good night. I'm going home.
Thank you very much.
All right, David, what do you think is going to be your priority here?
Our priority will be vital signs. Being that the patient has a stroke, we need to monitor her respiration. We also need to monitor the way her blood pressure, also her pulse, to know to see her. Also, we need to, because now she has started eating orally, we need to, and she has problems swallowing, we need to monitor or to supervise her when she's eating so that she doesn't get choked. So we need to know, make sure that we position her.
Remember, the first thing that we have to do is when we go into the room, we have to assess the patient before you even talk to the patient. So make sure you go and do a quick assessment.
Okay.
Keep that in mind.
I'll do that.
Are you ready to go take care of Mrs. Clemson?
Let's do it. Thank you.
Hello?
Hello, hi, how are you, Mrs. Clemson?
Who am I looking today?
My name is Josephine. I'm going to be your nurse today.
Good morning, Mrs. Clemson.
Hello, who are you?
My name is David. I'm a student nurse from Roxbury Community College. I'll be helping Josephine.
Oh, Roxbury. I hear that's a very good nursing program.
Yeah, they are very great.
Yeah.
Yeah.
Mrs. Clemson, can you tell me your full name, please?
It's Claudia Clemson.
Okay, how about your date of birth?
Well, why do you all always ask me that?
This is because we want to make sure we are taking care of the right Mrs. Clemson.
Oh, okay.
All right?
July 1st, 1937.
Thank you. How did you sleep last night?
I slept okay.
Okay. Do you have any pain anywhere?
No, I didn't.
Okay. I noticed that you have a cough. When did that start?
Right after I had breakfast.